understood what is the negative meaning of general symptom, positive meaning of general symptom, merit and demerit, and nobody has a difficulty. Any difficulty? Waiting for your response. Previously, any difficulty?
हो सर ही कर
काय झालं दिव्यश्री? What happened? So then we'll see the another terminology, that is particular symptom. Particular symptom is a symptom which is representing a specific part, representing the specific tissue, and representing a specific So we already seen the negative meaning of negative meaning of general symptom, that it is not representing a part, not representing a system, and not representing a tissue. That negative meaning of general part is just the positive meaning of this particular symptom. So particular symptom is any symptom which is representing a specific part of body, representing a specific system, excluding which system? Which system particular symptom will not represent? Divyashri, Komal Mahajan, can you answer? Which system the particular symptom will not represent? Particular symptom will represent all the systems except one system. Which is that system that is included in general symptom? No answer. So it is specific system excluding the autonomic nervous system, and the symptoms which is representing a specific tissue like tendon, serous membrane, mucous membrane. It is particular symptom. Then what is the merit and demerit of this particular symptom? It is a direct symptom given by the prover, and it is not interpreted. It is just mentioned under the heading of that anatomical part. That pain in the head caused by open air. So no interpretation is involved in this direct symptom, and most important, this symptom is more important for the final differentiation of remedy. The only demerit of this term is that there are so many vast particular symptoms. So it is really very difficult to study this particular symptom. If we say at least 10 organs and 10 symptoms, 10 particular symptoms, we will have to study 100 particular symptoms of a remedy imagine when you study the 100 symptoms, your brain is full of 1000 particular symptoms of 10 remedy. The memory of that your brain will finish. So it's the demerit that if we only focus on the particular symptom, it is very vast in number, so it is very difficult to study. And the difficulty, any difficulty in this general symptom and particular symptom. So remember, these two general symptom and particular symptom, these two terminologies are very important in homeopathic materia medica. Do not confuse in between these two terms, general symptom and particular symptom. If you understood the difference between general symptom and particular symptom and their relative value, most of the job of study of homeopathic materia medica is over. So whenever you are studying a remedy, you must focus what is the general symptom of this remedy and what are the particular symptoms of this remedy. And that will make the complete study of that remedy. Then one more term is clinical symptom. And this clinical symptom, this terminology is used everywhere in the medicine, in the homeopathic materia medica, and in the organa. Now, before we study this symptom in homeopathic materia medica, we will understand in medicine with what sense this terminology is used. When in a textbook of medicine, these terminologies are used with a specific context of that it is a clinical feature of disease. So the clinical feature of malaria is what? Chill and heat followed by the sweat. These are the clinical feature of that malaria. So the clinical symptom in the medicine is used with this context that any clinical feature of a disease is clinical symptom. Then the symptoms seen in a clinic. Symptoms seen in a clinic means what? Now this clinical feature of disease is mentioned in the textbook, is mentioned in the books of medicine. But all these symptoms are not seen in a disease. Only few symptoms which are seen in the actual clinic when the patient is in front of doctor. And these are the symptoms which are more commonly seen in the clinics. So that is the meaning in the medicine. And then it also means a common symptom of a group of disease. For example, diarrhea is a common symptom. So common symptom of a group of disease means diarrhea. Diarrhea is a common symptom of amoebic dysentery, bacillary dysentery, irritable bowel syndrome, ulcerative colitis, malnutrition syndrome, cancer of rectum. So, variety of group of diseases, and there is only one common symptom, that is diarrhea. So, diarrhea is a clinical symptom of this group of diseases, starting from amoebic dysentery to ulcerative colitis. So, in this textbook of medicine or in the subject medicine, this clinical symptom has this three context. And then when this term clinical symptoms is used in the homeopathic materia medica, we have to remember that there is a difference between these two terms, clinicals, which we have already studied and clinical symptoms. So clinicals of a remedy means the remedy is more useful in treatment of specific disease, and the symptoms of a remedy is more similar to a specific disease that we have already seen, therapeutic, clinicals, etc. But this terminology clinical symptom is totally different from that clinicals of a remedy. So clinical indication or clinicals of a remedy refers to a remedy is more useful in treatment of which type of disease, and it also refers that after the study of symptoms of that remedy, the symptoms of this remedy is similar to what different diseases is used in this both senses. But the terminology clinical symptom is altogether different. You remember these two terms are not same terms. Clinical indication of a remedy is different and clinical symptom of a remedy different. Now what does this clinical symptom indicates? We'll understand it. Now this clinical symptom has important four aspects. That these are the symptoms which were basically not observed in the drug proving. So a drug proving is carried out and it is compiled as a materia medica of that specific remedy. Up to that stage, these symptoms were never seen in the materia medica, never seen in the drug proving. But when this remedy is given on the totality of symptom, and in that totality of symptom, this specific symptom is not present. Totality of symptom includes other symptoms, and this clinical or this symptom is not included, and then the remedy is given on the basis of totality of symptom, and when that remedy is given on the basis of totality of symptom, it happens that the symptom has disappeared after the prescription of that remedy, and it not only happens once, twice, but it happens repeatedly, that when a remedy is given on the basis of totality of symptom, and that totality of symptom do not include this specific clinical symptom, but even then that symptom is repeatedly disappearing after giving that remedy, and then it is understood that why this symptom is repeatedly disappearing when it is not given on that indication. So here just remember that the totality of symptom on which a remedy is prescribed do not include this specific symptom. Let me take an example to make it more clear. So there is a patient having few symptoms. That symptoms is like that patient is having pain in the abdomen, patient is having nausea, patient is having vomiting, and since few days there is a burning sensation in the stomach, and you have given a remedy like phosphorus. Okay. And when you have given the remedy phosphorus, there is also one more symptom. The patient says that that specific symptom has also disappeared, and that disappearance of that symptom is repeatedly seen, and then it is further understood why this specific symptom is disappearing, and then it is retrospectively understood that if that symptom has disappeared, why a symptom disappeared under a remedy, and it is understood that because this remedy has the ability to produce this symptom, and when this phenomenon repeatedly occurs, then it is understood that probably this symptom is missed in the drug proving, and as the remedy has the ability to produce this symptom, then only it will relieve this symptom, and then it is added that symptom is added into homeopathic materia medicum, and such symptoms which are added after this specific process, these are called as clinical symptoms. And one example of this symptom is phosphorus as this symptom. The patient is having certain GI complaints, and that a patient desires for a cold water, and after taking that cold water, the patient feels better for 15 minutes, 13 minutes. But when this water becomes warm again in the stomach, it is vomited out. And this symptom of phosphorus is very characteristic symptom of phosphorus. But if this symptom was not originally seen in the drug, proving it was later on seen, and it is added as a clinical symptom. Is it clear? Any difficulty? Do you want the repetition of this clinical symptom? Then clinical symptom in the organ. So the clinical symptom in the organ, same meaning like that of homeopathic materia medica. And then what is the merit and demerit of this symptoms? That this symptom is basically, it is a proof of law of similia. So what is that law of similia? A medicine which has ability to produce the symptom, it will only relieve that symptom. So it is the reverse of this law of similia is also true. If a symptom is able to relieve that symptom, that means that remedy also has ability to produce that symptom. So it is a proof of that, proof of the law of similia. And at this time of symptoms are sometimes more useful in practice rather than the direct symptoms collected of a remedy. Remember the example of phosphorus. There are so many cases of GIT complaints are relieved only on this basis. And the demerit is again that it is an indirect symptom. It is not the symptom directly given by prover.